Okay, Jeremy, when you first entered our office, you were complaining of joint pain. You said that it was difficult to chew or eat and that you were on a liquid diet mostly.
Yes.
Is that correct?
Yes.
Okay. And what we did for you in appointment 1, we took records. We captured the shape of your teeth. We took a mold of your teeth. We captured your upper and lower jaw positions and your joint position.
Mm-hmm.
We then transferred all that information onto a precision instrument and we programmed it to behave like the way your bite behaves, the way you open and close, and the way that you move from side to side. In appointment 2, we made you a muscle deprogrammer. And now you're back for appointment 3. And you said that once you started wearing this, you immediately felt a positive difference.
Yes.
And that you were able to start chewing
Yes.
foods. Yeah,
Yes.
you were able to have a sandwich and you were able to have meals.
Mm-hmm.
And did your pain level go down?
Yes. Dramatically.
Dramatically. Okay, fantastic. How was your sleep? Were you able to sleep better?
Yes.
Able to sleep better. Okay. Today we just finished making you this orthopedic appliance. And let's see what we actually did for you, and let's see what the problem was to begin with. Let's actually take a closer look to see why you couldn't function, why it was painful to open and close, why you had the muscle pain and the joint pain, and why you have wear on your teeth, and what that has anything to do with the appliance that we made for you. I'm going to guide your lower jaw so your TMJ is in its natural home position. And when I close you, your teeth are touching, but they're not fitting together. Notice the space between all your back teeth. Now, if I were to ask you to squeeze closed, you would be able to fit your teeth together. Let's see what happens. Squeeze closed. Wow. Did you see that slide? That slide is how far your joints have to travel outside of their home position only for your teeth to fit. Open. Your joint position is right here. Your teeth are touching somewhere, but they don't all come together. They're not fitting together. Squeeze closed. That is a huge slide. It is because of this misalignment or this discrepancy that you've been bruxing. Your body has wanted to get the joints to go home, but the teeth have been in the way. So what we did is we made this appliance for you. Bite down, please. We crafted this appliance to your joint position. And we made a new bite for you while you're wearing this. So that when you close down, the appliance guides you to your joint position. So it guides the jaw so your joints go home. And it gives all the teeth a simultaneous place to rest on. It allows all your teeth to rest down with equal intensity everywhere. Now, what I'm going to do is open and close you to your joint position. And when we look to the back, we can see that all your teeth are touching. Squeeze. You squeezing?
Mm-hmm.
Yeah. But we're not seeing any teeth move. So your joints continue to stay home. Your joints continue to stay in their aligned and stable position, but your jaw is no longer moving. Your joints are not moving. Your joints are at home, but also your teeth have a place to rest on. Open. Everything's touching simultaneously. Squeeze closed. There's no slide anymore. Without the appliance, when your joints are led to their joint position, to their home position, and you squeezed, we saw a huge slide. No more slide with this. That indicates that your joints and your teeth are now coincident. That your joints and teeth are now in harmony. And slide forward and back. Slide to the right and back. Slide to the left and back. Was that easy to do?
Yes.
Is it smooth?
Yes.
You're gliding now. Forward and back. Left and back. Right and back. And when you make all of those excursive movements, when you move forward and back, side to side, we see that the back teeth separate. Slide left. Back teeth are separating. Immediately, slide left. Immediate separation. Back down. Slide right. Immediate separation of all back teeth. Back down. Slide forward. Immediate separation of all back teeth. Back down. Once your back teeth separate, you no longer have the ability to exert maximum pressure. All of your major clenching muscles get disabled, thereby preventing you from even attempting to grind or brush. This way now your joints are stable, your teeth are stable, the muscle tension is going to go away, the pain is going to go away, there's no more need for medication or pain medication or anything like that. You'll be able to resume your diet very soon, and you'll be protecting your joints and your teeth. And hopefully you'll also be sleeping a lot better.